Okay, so here we have the blood pressure cuff, right? Does anybody know what this is called? Very good, Patrick. It is called the bulb. Does anybody know what this is called? I want to say the spirometer. Yes, the spirometer. So this here is what we look at to measure, right? Measure the blood pressure. So when we put our stethoscope on, but when we put the stethoscope on, what is one of the first things you do before we start actually taking the blood pressure?
What I do, I'll open the valve to get all the air out.
And then what do we do to, where do we place the stethoscope for when we start taking the blood pressure?
Under the cup.
Okay, but we just don't place it under the cup, right? What are we looking for?
For the vein, straight, like right now, the artery.
We're looking for the heartbeat,
Right.
the heart rate, because that's what's gonna do the blood pressure, right? When we pump up the arm, we're gonna find the heartbeat, and then we're gonna place the stethoscope there. Let me see. I have the stethoscope.
I have one right over my neck. Here, there you go.
Okay. Okay. So
This is Michelle Juarez, and
I am a scientist.
I'm Loree Skidmore, I'm a nurse practitioner.
Yes, there we go. Formal introduction. Thank you. So I'm going to take Loree's blood pressure, and then I want one of you guys to come and show me how you take the blood pressure. I'm going to put the cup on.
And this is a thin shirt, so that's fine. A thin shirt, you can even listen through a thin shirt. You know, you don't have to like take somebody's shirt off if it's thin, but if it's bulky at all, then you do need to.
And we also know that clients are difficult when they have multiple layers of clothing on. To get them to take their clothing off, it's difficult to do that. So that's probably when a device like this, or even the other one that, what is it called? The blood pressure cuff? Yeah, just the cuff would be good.
Although those tend to be very inaccurate on big people.
They can be, yes.
A lot of our clients.
Okay, so I'm going to, and you want to make sure that the arm is at the level of the heart, right? You don't want to take the blood
And I
pressure.
should really be resting it like here.
Yeah.
Yeah.
We don't want the blood pressure, the arm to be down here, so it's not even with the heart.
That's really important, because if it's, what it will
That
do.
could be hard for them to.
Well, no, you don't want them to hold their arm. You need to rest it on something. Yeah.
Yeah, we have one chair with a.
Yeah, no, they need to, and then you also want to, I think that the pulse tends to be lateral in most people, like the inner aspect, it's going to be more like over here. And like right, like more like in there.
There we go.
Okay. All right.
Oh, this is a good stethoscope.
Good.
I can hear everything. Okay, so now, normally, if a person doesn't have high blood pressure or anything, we want to pump it up to what, Rosa?
180.
About 160, 180. Now I'm going to let it go, release slowly till I hear the first step. So she's about 124 over 62.
Good. Perfect.
That's a good.
It should be. I have hypertension and I'm on 3 meds.
So that's a good blood pressure right there. So
Oh, sorry.
we have a chart here that shows hypertensive, low blood pressure, normal blood pressure, and hypertensive, high blood pressure. It's kind of hard to see what the color should be because of the printer, but this is just kind of like a range of what you guys want to go by. There's more than just what is put on the paper for closeted patients, and we really need to emphasize that, because sometimes when we're taking blood pressures consistently, sometimes it's when we find that a patient may be hypertensive, or have low blood pressure. So then we can refer them to the nurse practitioner for further assessment. So,
And as Patrick said, people often won't be symptomatic. The most common symptom of untreated hypertension is headache, but most people don't get that, so that's, but some people who have high blood pressure will say, oh, if it's out of control, I notice I get a headache. So
especially for psych patients too, because we know that they have a really high tolerance for pain, right? So a lot of times they're not going to complain that they are hurting, that a part of their body's hurting, or that they have a headache, because they don't want to take any more medication than they're already taking, and two, because sometimes they just don't feel it. Patrick, why don't you come and take my blood pressure? So the other thing that we really want to emphasize is the size of the cup that you use according to the size of the patient, right? So just say, for instance, you use this cuff on a patient that's 300 pounds. And this cuff is probably not going to give you an accurate blood pressure. You're going to have to go to a bigger size. Or somebody who's 150 pounds, this here will probably be a good, blood pressure to use. But for somebody who's like 180 pounds, like myself, with big arms, you still may want to consider using a bigger blood pressure cuff.
I have Gregory, and he is a football player, and his biceps are huge.
Mhm.
So I have to use the large adult cuff on him.
Yeah.
Whereas taller than he is Timothy, but he doesn't have that curve. So I find that the regular blood pressure cuff works quite satisfactory.
So that's for the machine. You want to do manual. This is too small. This here's a large adult.
And this is regular.
Yes, but we don't want to use the machine. We want to use manual.
Manual here.
Yes.
And it merits, if somebody, I know it merits at least putting it in the NP log and maybe even calling if somebody's blood pressure is really, really abnormal. But whatever device you use, always want it at the level of the heart. So that means if you use the wrist, they should actually hold it like this. They should rest it against their chest. It should be at the level of the heart for the most accurate. And the wrist one works best for folks who are smaller, smaller human beings.
Notice the earpiece. Notice the angle. That's very important because the angle is meant to go into the canal of the ear, and you'll get a better sound.
Right. If you get them backwards, you may not be able to do anything, even with a good stethoscope. So, yeah.
I already felt the pulse in this location. Do you have high blood pressure?
No, I don't take any medication.
Okay. What's your
You tell me.
Huh?
You tell me. After you're done, I'll tell you.
So I've gone to 160. $120 over. $120 over 76.
Yeah, that's good. That's
Excellent.
about average. That's
Nice.
about blood pressure, which is really good.
Yeah, that's good.
The other thing that I was doing that I shouldn't do is the client's feet should be flat on the ground.
Yeah, no crossing your feet, no crossing your knees, no twisting around. People shouldn't talk, they should stop talking, close their mouth and stop talking.
So when should you recheck a blood pressure? Does anybody know about recheck?
As a word.
So if a patient has a blood pressure, say that's really high, 2 something over, 190. Or so you're going to check it again, right? Because sometimes the first time something could be wrong, the arm could not be resting right, the patient could be fidgety, moving around, or the feet, there could be something. So we want to do a recheck. The second time, if it's not as high, but it's still high, you recheck it again. So we're going to do 2 rechecks before we get somebody else to come in and take the blood pressure, then, to do a secondary. Because sometimes, and it's nothing against any of us, sometimes we don't get an accurate blood pressure of our own, volition. So sometimes it's better to get a second party in to go ahead and retake the blood pressure. If you get a blood pressure like on this machine that's not accurate a few times, then before you get a second person, we recommend that you do a manual. And then if you get a high blood pressure or even a low blood pressure, a really low blood pressure, and we had a client, Patrick's very familiar with, that had really low blood pressures. And that unfortunately was his baseline. He needed some medical attention. He refused that medical attention and that became his baseline. Then you want to get another person in to check the blood pressure again. We really want to emphasize blood pressures because blood pressures can mean a lot of things for a client with medications, for a client with medical, if they already have medical issues, or they could possibly be coming into a medical issue that, may need further, we need to check further. So, so that's that on the blood pressure. Do you have anything else you want to add on the blood pressures?
I don't think so. Yeah, just in general, I'm just kind of old school, but I think the manual ones are to be trusted more accurately than the mechanical ones because they can have more. But there's also, you can get like a leak. You can get a leak in the tubing, and that will throw off your blood pressures too. That's why you want to switch to a different device if you're getting an abnormal number. And then also just that, especially with our clients, that people can have really abnormal blood pressures and not necessarily be symptomatic. So it may be accurate because I think sometimes, I remember when I first became a nurse, I was an MA first, but and it's like, I remember the first time I took a bunch of the vital signs at the hospital going at the evening shift. I mean, I had numbers all over the place. And I was like, oh my God, I don't know how to do this, and I was tempted almost to like just write that they were normal. But I mean, it's just, sometimes people's vitals are really, their blood pressure could be really off. So, you just want to verify it again and make sure that that's accurate. So,
and that's the other thing that we should just, throw out there is that it's really important that you write the accurate blood pressure down. Don't make up something. Don't put something that's close to it. It's just really important that we put the accurate blood pressure down. And if you are nervous about taking blood pressures or you don't feel confident enough to take these blood pressures, then, that's where the team leader or even, one of your peers, coworker peers, can step in and help you become confident in taking blood pressure. Because that's really important. It's a really big part of your job when you get on shift. So,
like Mr. Eyebold, like recently had a really low blood pressure. And yet he was up walking around and said he felt fine. You know what I mean? So because I checked and I was like, geez, and so it was accurate. He just had a really low blood pressure, but he was tolerated, so. Oh, I'm thinking of Cartmel then. I'm thinking of Cartmel.
Yeah.
That's right. Yeah. But you're right. Yeah, exactly. It was him.
And
Yeah.
they changed the meds
Yeah.
in order to get a grip, higher blood pressure.
Yeah, exactly.
So,
Yeah, it was Cartmel.
So who knows what the resting heart rate is?
Normal.
Okay.
Perfect. All right.
Resting heart rate.
Normal resting heart rate.
There's a graph, yes. So it kind of also varies on age. So I put in like a little graph back here. And a lot of this stuff I got off the Mayo Clinic med thing that I really go to. I trust. So it also depends on the age too. Medical conditions and stuff like that. But this is kind of like a little graph that you guys can refer to. I was thinking about making little cards that you can stick in your badge, just in case, you forget what those numbers are. Oftentimes I get busy and I forget to, you can just refer to. That way when you feel like something's not right and you look at your card and it's not, you can go to the team leader and say, this person's heart rate, this person's O2 stat, blood pressure is not right. O2 stats, just real quick. What is a critical, need to be notified doctor, MP, team leader, license, O2 stat?
Under
It's as soon as it gets in the 80s, 89, 88. I mean, we've sent clients out with 88 O2 stats. It's really important that, if you got a client that's, and check it. You check it on the other hand, check it on a different finger. I would do like 2 checks to make sure that that's, what you're going to get us all. Because if that's where medics become involved in stuff like that, where we ship them out. So I'll make sure that we get an accurate O2 stat for that. So how to take your pulse. So one of the things also I want to say is, does anybody know how to count for 30 seconds and multiply the count by 2? Or count for 10 seconds and multiply by 6?
oh,
So yeah, so that will make a minute. Do you guys know how to do that? Because it's really,
It's easier to do
I didn't know other than 6.
sometimes it's just better to just to take it for the full minute. But you guys have a full list of clients, and so if you want to, just move a little faster, that's how you guys can take a pulse rate a little bit faster. So
another good reason to take it for a minute is you can feel if there is an irregularity.
okay, what's a radial pulse? Anybody know? Wrist, cauterized pulse. Okay. And checking your heart rate with an assisted device. So that's like the little O2 stat thing. Or if you have like one of these blood pressure cuffs and you're doing a blood pressure, then you also get the heart rate. Some of them also have O2 stats on them and temperatures, which are really nice. I don't think this one here has O2 stats though, or temps, but it does have a heart rate. So you can also check it there for that. And pedal pulse.
Pedal pulse isn't
Oh.
that?
It's the top of the foot. That's where your pedal pulse is. Your brachial pulse? Yes, that's your brachial pulse. It's most commonly actually used in young children. Okay, and then I get you guys have the heart rate things and stuff like that. So
And the most common errors in pulse with the electronic device is they'll either count half the pulse if it's weak, or they'll double count it. So if you get a really wild, number using an electronic device or with your pulse ox, also sometimes if somebody has a tremor, it'll count some of their tremors as pulse. So so if you get it's like the blood pressure, if you get a weird result, recheck it with another device, and yeah.
I do have a question because I really rather do manually just because it's more accurate. Every time I do it on that machine, it gives me odd numbers, and the way I learn it is that they're not supposed to be odd numbers in the blood pressure. So that throws me off every time. So it's not,
trust the machine.
yeah, no, because it give me all kind of like odd numbers. So which is that okay?
That's fine. I mean, actually, most places, if prefer the manual, but we're living in technology times, and there are people that like to use the machine. So whatever your preference is, whatever you feel comfortable with.
So my question is okay to write odd numbers?
Oh, that's your
You
question?
mean like 67 instead of 66?
Yes.
Yeah, because these measure it more exactly than the little increments that you see on the on the dial. So that's why, I mean, they're just, they can give you, so it can be accurate. It can be depending on the device, it can be, so yeah. So, and the pulse can be very significant. And also, again, the beautiful thing about the manual one is that you could notice if it's irregular, because a lot of people develop arrhythmias over time and they don't have any idea, especially older folks who get atrial fibrillation, and they may be walking around for months with a higher risk of having a blood clot because nobody has noticed, they haven't seen their provider in 3 months, and so nobody. So it can be very helpful to let somebody know that the person's having skipped beats or an irregular pulse. And then, I remember I had a lady come through back when all the antihistamines like loratadine were still prescription, and she was heading down to her daughter's wedding, and she had she just wanted a prescription for loratadine, and she was going to Santa Cruz, and she hadn't been in a long time, and her heart rate was like 120, and so and she was just a healthy 55-year-old woman. Well, so I ordered some things on her because there's several things that can make your heart rate really fast. But she ended up having lung cancer, believe it or not. I mean, I got a chest X-ray on her, not before the wedding, but I said when you get back, get some labs, and she ended up having lung cancer. So I mean, just your vital signs can sometimes be off with something very significant that you would never think of, So yeah.
And the top blood pressure is what?
180 for the whole, right?
No, but what is it called?
Oh,
Just it's solid for the solid.
And the bottom blood pressure is
Diastolic?
just diastolic. Yeah. All right, so I think that's it for me. We're gonna let Kurt have the last.
Couple questions. When do you do everybody? Or do you never do everybody?
We do everybody, yes. So we have the first weekend of every month that we do blood pressures. And we also do weights. Yes, the first weekend of every month. And sometimes it goes into the second weekend, depending on the date. So say like a Saturday is the 30th and a Sunday is the 31st, then it'll go into the next weekend. Yeah.
the one other thing I was going to say about the pulse ox and the pulse is that there's a couple of reasons it might not work accurately. One is because it's so low. Like you've got somebody whose blood pressure is so low that it's not picking up. The other reason can be that they're cold. And that's not so much an issue around here as much, but some people just in the winter may have really cold extremities.
Yeah.
And you're not going to be able to get an accurate pulse ox on your finger because they're so cold. So you need to have them warm up, or give them a microwave, something to warm their hands up first, because then it will work. So before you decide there's something really wrong,
And before Kurt takes over, is there something that you guys specifically want an in-service in? Something that you feel could help you be better in your job? You guys just freaking have your job down, right? I know, right? Yeah. So Loree and I we actually have a couple of other in-services that we're gonna be doing. One is gonna be like weights, because we, weights are important, especially with us trying to incorporate in the future, healthy eating. So we're gonna show you guys how to do proper weights, and we're also gonna do an ADL group, an ADL in service, because ADLs are really more important than we think that they are, especially when it comes to the client's esteem, your relationship with the client, a lot to do with trust, and stuff like that. So those are the other two in services that we're going to be coming up with.
and for me as a clinician,
You see things that
they
they
say
said.
things so that to help you identify that it's not your fault if they don't comply with your care, but it is your responsibility if you see something abnormal to let me and Michelle know that, so we can do something about it.
Michelle, the MP.
Yeah, the Michelle.
Yeah,
Yeah.
or,
Yeah.
the team leader that can notify,
Right.
the MP. So, or a license, Tatiana, we have licenses, we have, anybody that's a licensed team leader or, the FMP. So, all right, Kurt, you're up.
I just have a.
Do you want to sit over here?
Show you.
Does he need to be? Or-
This is what it's gonna be. Your number. That's the form.
Oh, you know what? I actually did want to take care of it because
I report, but I'll explain more.
I'm gonna go.
Thank you so much.
See you guys later.
All right.
Thank you.
No,
He wants us to keep going. Oh, you're welcome. Yeah, you. This is great.
That's the final form.
I guess I could add it.
Oh,
Yeah. Yeah.
So, what this,
What I get my report?
what I'm gonna show you about this is that a couple things that you brought up that give me something to think about. This right now will only take their vitals and heartbeat, blood pressure, getting city, oxygen.
Take you off the recording.
Right, temperature, weight, and oxygen. So these are all the things they take. But